We are joined by the illustrious Dr. Audrey Klenke from Pinnacle Plastic Surgery.
Thanks.
Glad to have you here. Now, we've all heard about a mommy makeover,
yes.
Okay? But today we're going to talk about how to go from grandmother to glam mother,
That's
okay?
Right.
So what kind of procedures would one expect to receive during a glam mother makeover?
So glam mother, you're sort of geared towards, you know, the 50 and older crowd usually. So they have different perspective and things that are more important to them. So common things are facelifts and neck lifts. I'd say that's probably the most common thing, but eyelids are also very common. And in fact, as we get older, sometimes you can't see as well when those eyelids start to get really heavy and droopy.
Yes.
Eyebrows can be a common thing that they want improved on. Around the mouth area, arms, there are certain things that they sort of tend to lean towards, so those are the common ones.
Okay. And which procedure do you see the most wow factor in?
Honestly, I'd say eyes. Anything around the eyes. So eyelid lifts, whether it's upper eyelids, lower eyelids, and the eyebrows, tend to give you the most wow factor, because when you look at someone, oftentimes the first thing you look at is their eyes.
Right.
And especially our folks that have those big, beautiful, light-colored eyes, but even the brown-eyed folks, like me, can benefit. And there are things that can also help that are non-surgical, things like fillers, and even Botox around the eyes can help too. But eyes definitely give you a big bang for your buck.
Sure. And what procedure are you seeing as the most popular with this fabulously mature crowd?
Yes, I would say probably the facelift neck lift combination, where you're addressing the sort of mid-face, the jawline, because a lot of people tend to get sort of full right here, the jowls, they hate those.
Yes.
And these lines from the nose down to the jawline, those are improved upon. And then the neck, because when you look at the face, oftentimes you're looking at the face and the neck at the same time. Or people will improve upon their face and then really be bothered by their neck. So oftentimes we're addressing them at the same time. And a lot of people who, you know, if they're going to have surgery anyway and make a big improvement, fat grafting is a pretty common thing now, where you borrow a little fat from the tummy and you can put it anywhere that you would put a filler. So there are lots of different areas in the face that could use a little volume boost.
Sure.
Yeah.
So the surgical procedures we've just talked about, what are some of the non-surgical procedures that can be done that take us from gram to glam?
There are lots. So there are, of course, the fillers and the injectables, so things like Botox that relax muscles that make those pesky wrinkles, and fillers that add volume. We have things like lasers in our back pocket, so there are resurfacing lasers that can really help with your skin texture, fine lines, wrinkles, dark spots. There are things like hydrofacial, which is a no downtime, very exfoliating, very hydrating treatment that's done by our esthetician. And things like permanent makeup are actually really popular, because nowadays
it's changed so much. The technology has changed.
Yeah, things look much more natural, but it saves you downtime. I mean, people are penciling their eyebrows every morning. What a pain, you know, just have someone
get it done.
Yeah, just get it done. Lips, lip liner, eyeliner. So those things are wonderful, and they're easy to do in office, minimal downtime, and people just love it. Makes a big difference.
So going from gram to glam is a beautiful process. And does everybody get the same treatments with this makeover?
No, I would say the important thing to know is that everybody comes in with different things that bother them and different expectations, and really we have something usually to address each of your concerns. So it's really about me listening to what bothers you and then coming up with a plan really that's really for you. So not everybody needs the same thing or wants the same thing.
So really a consultation is your best move.
Right, yep. So we usually set up our consultations for about an hour so we can really sit down and talk about all the different options. And they are $50, but that does go toward any treatment that you do. So yeah, we love meeting with people and really going through all the different possibilities. There's so many.
We are joined now by Becky Brinson, who is Pinnacle Plastic Surgery's own certified permanent makeup artist. We're talking about going from gram to glam today, and one of the most exciting things that happens at Pinnacle Plastic Surgery, which I'm actually really curious about, is permanent makeup. Now, the history of it, I mean, we've all seen folks with sort of the old technology, and the new technology is totally different. What are some things that you do, Becky?
The hair stroke eyebrows is totally different than it was before. At one time, it looked like it was Sharpie marks, and now it's more hair strokes. It actually looks natural.
Wow.
And whenever you look at it, you see the little lines, and so it makes it look more like hair.
I think too, Becky's colors are really natural. So some, especially our 50 and older crowd, don't necessarily want black eyebrows.
Sure.
Or it doesn't go well with their hair. Becky does a great job. I don't know how the colors have changed, and they probably keep changing. So
Yeah.
And I
patients
try to
love
match
that.
it. I try to match it up to their natural hair color. Or,
And the eyebrows lose pigment over time?
it can. It's really according to what you use on your face, the products that you use. It can fade them. Also, like if you're in the pools, chlorine, that can also fade them.
And the sun
usually,
can bleach them a little bit?
Yes,
and everything?
ma'am. And also, it's probably about, it takes like 5 years. You might need a touch up, but some people
that's
don't.
a good question. And I don't know if any of y'all can see Becky, but she has permanent makeup on her upper and lower lids for eyeliner, and it looks so natural. It looks absolutely beautiful.
Thank you.
And how long does a permanent makeup last? Let's talk a little bit about that.
I actually had my eyeliner done 11 years ago.
Get
so,
out of here.
and it's,
If y'all could see this up close, this is incredible.
Looks good. Looks good. I'm jealous. I've already told Becky I'm in line for my eyebrows. My mother had hers done years ago, and the Sharpie look.
I need
So
to edit. To
Becky
my...
can correct that. Actually, she can sort of undo a little bit of what's been done.
So Becky, how long does the process take per area?
per area, it's usually 2.5 hours. About an hour and a half for the eyebrows.
For both of them?
Yes, for
Oh,
both
wow.
eyebrows.
That's
and
fast.
about an hour, I would say about an hour for the eyeliner. For the lip, I would say about an hour and a half.
Wow. So you're just good to go when it's done?
Yes, good to go.
No
You just put a
downtime.
little bit of A&D ointment on there and you're good.
And is it exactly the way it's going to be?
It'll, in like 3 days, it'll start to flake a little bit. In 5 days, you will actually see the final result.
Wow.
It's amazing. It's so fast.
That is so fast.
No. Never have to pencil again. Can you imagine?
No, I can't. And the change in it. Now, what about that like old school technology, Sharpie technique that looks sort of,
You mean for the eyebrows where
awkward?
it looks weird? Yeah.
Can you fix that?
Actually, yes, I can. I could do it's called hair stroke simulation, and you actually make it look like hair instead of just a Sharpie mark.
Wow.
And it's just little strokes that make it look like a piece of hair.
And speaking of hair, we have something out there for our men folks too.
Oh yeah.
What are some of the procedures that you do for
Actually,
men?
if people are balding, I can actually make it look like they do have hair with the simulation hair stroke technique.
So she can actually do it in the scalp. And sometimes we have women who actually either have thinning areas or sort of light areas or kind of balding areas, and she can cover that up too, as well as scars. We have a lot of patients who have scars either from burns or other previous surgeries.
Oh, that's huge. Talk about that a little bit.
Yes, we had several patients with burns, and I would actually camouflage. You try to match the pigments of their natural color, and then when you do that, it actually looks like it's natural.
It's
wow.
phenomenal.
And then you actually can put kind of like little freckles to make it look like it's completely normal, and it doesn't look like a patchwork.
That's incredible because
it looks 3D. I mean, it looks real. Like it matches.
unbelievable. What about like biopsy scars and that kind of thing?
Yeah.
Is that?
You could do that too.
And Becky does a great job too with the 3D nipple and areolar reconstruction for our breast cancer patients. So I do see a lot of patients with breast cancer, and sometimes you can't save the nipple and the areola. But in the old days, and Becky can tell you that it sort of looked very 2D, sort of like a pepperoni. But Becky's technique makes it look real.
Because that's, being able to not only conquer the cancer that you're facing, but to be able to then bounce back aesthetically. What an incredible service.
Yeah.
Right.
Incredible service. Now, August, you all have a special that's going on that I want to talk about and that you all need to take advantage of. It has a fantastic name. Tell us about it.
It's called Lips to Lashes. And actually you come in and you have you can have full lips done or the liner, and then you get a free latisse. For the latisse is $179, but you get that free.
Great deal. And for any of you who aren't familiar with latisse, can you tell us a little bit about it?
Latisse is great. It's actually just a topical solution. You just paint it where you would normally put your eyeliner, so your upper lashes, and people put it on their lower eyelashes too, and they grow, so they get thicker and longer. After about 4 weeks, you really start seeing some changes. The full treatment's about 16 weeks, and then you just have to do maintenance where you put it on once or twice a week just to maintain them, but huge difference.
Yeah. So the special in August, Lips to Lashes, you go in and you get your either full permanent lip done or the liner done, plus free latisse. You can't beat that deal. Make sure that you get your consultation or just stop by Pinnacle Plastic Surgery. You won't be in better hands than with these ladies.
Thank you.